benzodiazepine group of drugs: barbiturates, benzodiazepines, and non-benzodiazepines, among which the safest are the non-benzodiazepines, the toxic are the barbiturates, and drugs which are still in use depending upon benefit versus the risk are the benzodiazepines. Now, although the clinical use of the drug is sedation and hypnosis, but other than that, it is used by the anesthesiologist for pre-medication purpose. It is used by surgeon for skeletal muscle relaxation. It is used for epileptic disorders. It is used for amnesia, so that the person loses a memory from that point onwards, for diagnostic purposes, to calm a patient, for anxiety, and so on. So those are the different aspects where these sedative and hypnotic drugs are used. So sedation means to calm a person, anyone who is very anxious, anxiety. You need to give these drugs at a lower dose so that you can decrease the anxiety level, you can decrease the alertness of the person. So these drugs have their very important role in sedation. Hypnosis, that is to induce sleep. We all loves to sleep. We sleep till 7, till 8. Some of you might just woke up right now. Some of us have the habit of sleeping early, 8 o'clock, 9 o'clock. Some of us have the habit of sleeping late, 12, 1. But other than the duration of sleep, there are other important aspects inside sleep also. Because the drugs that we will be talking, whether it is sedative or a hypnotic drug, both of them are the same. They are used for sleep disturbance or sleep disorders at the same time. A low dose may be a sedative, but a higher dose is a hypnotic. Another basic difference between a sedative and hypnotic drug is that if you see the picture, drugs which have a shorter half-life, they are basically used as a hypnotic, whereas drugs which have longer half-life are used as anxiolytic or a sedative drugs. Because if you give a drug which has a very long half-life to induce sleep in a person, then when the person wakes up in the morning, you'll still be having the hangover effect, may not be able to concentrate at all, might even go back to sleep. So another difference between a sedative and hypnotic is that hypnotics, they have shorter half-lives, whereas sedatives, they have longer half-lives. Now, the duration of sleep for an average person is around 7 hours. Some people can adjust with just 4 hours of sleep, whereas some require 9 hours of sleep. But basically, this duration of sleep tends to decrease as your age advances. Now, when we talk about sleep, there are two stages in sleep. One is what we call as REM sleep, and one is the non-REM sleep. Right now, let us forget about the non-REM sleep and just stick with the REM sleep. The full form of REM stands for rapid eye movement. That is, some of you might have experienced waking up at the middle of the night and the only thing that you can move is your eyes. You can look up, down, right, left, but you are not able to contract your muscles. Basically, we say that you have woken up during the REM sleep. Your body is still asleep, but still you're awake. So that is when you wake up in the REM sleep. It is a little bit scary, but that is what happens. Now, in your REM sleep only, you tend to see more of the dreams. There is more of cerebral activities. Cerebral activities means there is more consumption of glucose, there is more blood flow, more oxygen demand, and so on. Now, if your REM sleep is disturbed for 7 days, 10 days, or for a prolonged period of time, you tend to develop some kind of psychological disorder. You might have a behavior disturbance, irritation, dizziness, nightmares. These sedative and hypnotics for ordinary people who are not able to sleep, because these drugs can hamper the REM sleep. They suppresses the REM sleep. This one is showing some network issue. Are you able to hear me? Yes, no?
Yes, sir.
Okay. So if you see this diagram over here, when you go to bed, you're still awake, then you enter the sleep cycle. First you see the REM, then you enter the non-REM stage 1, 2, 3, then you come back to REM again, then again you back to the non-REM, and so on. During sleep cycle, you might have experienced that you tend to see so many dreams. None of the dreams are attached to each other. Every dream has a different story.
Sorry.
You will see a dream about riding a bike, then again you will enter a different dream in which you are in some other place. So those two dreams might not have any connections. That is because when you dream at one point, you might be in this REM cycle. When you are in your next dream, you might be in a different stage of REM cycle. Then again, you might dream again and you might end up in a different cycle. That is why you see multiple dreams depending upon how many times you have entered the REM cycle. So basically, in your REM sleep, you tend to see more of dreams, there is more of activity, and even if you happen to wake up during the REM sleep, then the only thing that you're able to move are the eye muscles. Your body is completely paralyzed for a period of time. And these sedative and hypnotics like drugs, they disturb or suppresses the REM sleep, which leads to some kind of psychological disorders. In fact, this psychological behavioral disturbance, irritation, phobias, nightmares are one of the adverse drug reaction of sedative and hypnotics. That is why a person who takes these sedative and hypnotics is not able to completely let go of these drugs, because once he leaves these drugs, then his REM sleep is disturbed, due to which he will be having those irritation, nightmares, and in order to sleep well, he will again take these drugs. So that creates a dependence in that person, the requirement of drug in order to achieve normal sleep. That is why we do not simply prescribe these sedative and hypnotics to ordinary person who are not able to sleep properly. Now, like we said before, there are three categories of drugs: barbiturates, benzodiazepines, and non-benzodiazepines, all of which they fall under the sedative and hypnotic category. Now, among these three drugs, barbiturates are drugs which was once used. It is still used, but only few drugs from the barbiturates category. We basically use more of benzodiazepines and non-benzodiazepines. But why barbiturates are not used now then? Is it not important? The answer is that barbiturates have more of toxicity. They have lower therapeutic index. They produce more of dependence, physical dependence, psychological dependence. But among those barbiturates also there are two barbiturates which are still in use. One is thiopentone sodium, which is used as an inducing agent, and phenobarbital, which is used for management of convulsions during pregnancy. Besides that, it is used for sedative and hypnotic purpose. It is used in cerebral edema. It is used in cerebral ischemia, because these barbiturates, they decrease the activity of the brain. By decreasing the activity of the brain, they decreases the oxygen requirement. That is how it is able to help during cerebral ischemia and prevent cerebral infarct from happening. But those are those indications which was once upon a time. Now we are not using these barbiturates for cerebral edema or cerebral ischemia, because we have newer drugs which are more safer than barbiturates. So when it comes to barbiturates, we use only two drugs, that is thiopentone sodium and phenobarbital. Other than that, barbiturates are not used clinically. But still, we need to remember few of the drugs like phenobarbital, which is a longer acting used for management of convulsions, seizure, or epilepsy, especially during pregnancy cases. We have cicobarbital, and we have thiopentone sodium, which is used as inducing agent. This thiopentone sodium is ultra short acting, means it has a very short half-life. Why it has a very short half-life is because of rapid redistribution. Now, this property of rapid distribution comes from the sulfur that it contains. You can see the name of the drug itself is thiopentone sodium. Thio means sulfur. Any drug which has sulfur in it are more lipid soluble in nature. So when it is more lipid soluble, it is able to enter the brain, it is able to produce that reaction, and it will immediately leave the brain also, making it very ultra short acting drug. So you need to remember phenobarbital and thiopentone from your clinical aspect, from your theory aspect, as well as from your viva aspect. Because if anybody wants to ask question from barbiturates, you will ask only from phenobarbital or thiopentone sodium. Now, just like phenobarbital, benzodiazepines are also short acting. They are used for intermediate acting and long acting. The drugs which come under the short acting are triazolam, oxazepam, or midazolam. And these drugs are short acting, not because they are lipid soluble, they do not have sulfur in it, but they are short acting because they undergo direct conjugation. They do not need to enter the liver for metabolism. They directly conjugate and they are easily excreted from the body, due to which they are short acting in nature.
No, Lord. Giri, Giri, not a one. Huh? Not a one. Yeah, no, no. Estou tá no meu, tá tapado mesmo. What? No, I don't know that because my
Yuvraj Yadav, better turn off your mic. So we were talking about benzodiazepines. We have some intermediate acting like lorazepam, alprazolam, temazepam, estazolam, and nitrazepam. Among these drugs, lorazepam, alprazolam, and nitrazepam are frequently used. These drugs are also used to take advantage of situations, like they are used for day trip drugs also, because not only they produce sedation and hypnosis, they also produce amnesia. Means when you take this drug, you will forget whatever has happened from the time this time onwards. You'll be having amnesia, and that amnesia is called anterograde amnesia. You consume the drug, then you forget everything what is happening. Then you have longer acting drugs. Now when we talk say longer acting drugs, we have drugs like diazepam and flurazepam. Why diazepam? Because it forms a metabolite which is even longer acting. We'll come to that in the later slides, but just remember that diazepam is a longer acting benzodiazepines. Then we have some non-benzodiazepines also. These drugs are there because they are comparatively safer than both barbiturates and benzodiazepines. They are drugs like zolpidem, zopiclone, S-zolpiclone, and zaleplone. Now, basically, the mechanism of action of these sedative and hypnotics are same. That is, they mimic the GABA. GABA stands for gamma amino butyric acid. Basically, it is an inhibitory neurotransmitter. We have these GABA in our brain, but these drugs, they only enhance the activity of GABA. Higher dose can mimic the activity of GABA also. So basically they enhance, or in other words, Nepalima भन्दाखेरि उक्साउने, the activity of GABA. Now basically this GABA is an inotropic receptor. It allows the influx of chloride channel. And this GABA receptor, it has site for both benzodiazepines and barbiturates. Now barbiturates is going to go and bind to the GABA receptor. Upon binding to the GABA receptor, it will allow the influx of chloride ions. Now if you give barbiturates at a very high dose, it will also have a GABA mimetic action. Means even if there is no GABA or very less amount of GABA, all the GABA receptors might be stimulated, which brings us to the conclusion of adverse drug reaction. That is, too much of CNS depression can lead to respiratory depression, and the patient can go to the stage of coma itself. But smaller dose of these barbiturates will have a GABA facilitator reaction. This will facilitate the binding of GABA. Now this is GABA receptor. It is a pentameric receptor with 2 alpha, 2 beta and 1 gamma subunits. We have the extracellular part, we have the intracellular part. So we have the benzodiazepine binding site, we have the barbiturate binding site, and we have a GABA binding site also. When GABA will bind to the GABA receptor, it is going to open this GABA A receptor, which will allow opening of this GABA receptor, and there will be influx of the chloride ions. Chloride is a negative ion, which means if it enters inside the cell, it will lead to hyperpolarization. The cell becomes very negative, so much negative that it will not be able to get excited upon stimulation. So that is how these barbiturates and benzodiazepines are going to work. They will produce hyperpolarization of the neuron cells. Now, GABA receptors are of 3 types, GABA A, B and C. But from sedative and hypnotic aspect, GABA A receptor is important for us and not GABA B and C. So if you see this picture, here we have the chloride ion that is not able to enter the cell because there is no binding of the GABA. But as soon as the GABA binds to the GABA receptor, there is opening of the receptor and there is influx of the chloride channel. Now, when chloride enters the cell becomes very negative. That term is called hyperpolarization, and once hyperpolarization is established, the cell will not be able to get excited. So this is what hyperpolarization means. With the influx of chloride ions, the negative potential of the cell further decreases. So if there is any stimulation at this point, the cell will not be able to depolarize. Benzodiazepines also facilitate the action of GABA. But where, but where the difference lies between the barbiturate and benzodiazepine is that barbiturates are able to mimic the activity of GABA. They can behave like GABA, but at a higher dose, whereas benzodiazepines are not able to do so, making benzodiazepines safer than barbiturates. Another difference between barbiturate and benzodiazepine is that barbiturates they prolong the duration of chloride channel opening, whereas benzodiazepines they increases the frequency of chloride channel opening. Giving barbiturate at a very high dose will mimic GABA, which means in the absence of GABA also, the GABA receptors can be stimulated, hyperpolarization can be established. But with benzodiazepines, it is not so. Giving a very high dose benzodiazepine cannot stimulate the GABA receptors, making benzodiazepines far safer than that of barbiturates. Now, there are two types of benzodiazepines receptor. One is BZ1, which is present in the cerebellum, which is responsible for hypnosis, anxiety, and sedation. And then we have BZ2 receptor, which is present in the basal ganglia and hippocampus, which is responsible for anticonvulsant action, amnesia, and muscle relaxant action. So if you are using a BZ1 specific drug, you will be able to produce anxiety, sedation, and hypnosis. But if you want amnestic action or anticonvulsant action, you will have to stick with the BZ2 receptor. Now the prototype drug that belongs to the benzodiazepine category is the diazepam itself. If you see the diagram of diazepam, you will find that there are benzene rings. Presence of benzene ring or presence of sulfur in a drug will make the drug lipid soluble, which means these drugs are able to cross the blood-brain barrier, they are able to cross the placental barrier. Now, once this drug is able to cross these barriers, means that they are easily absorbed from GI tract also. Once it is absorbed from the GI tract, it will enter the liver for metabolism. Now, we have categorized diazepam under long-acting benzodiazepines. Why? Because if you see this diazepam over here, once it enters the liver, it will form a metabolite known as this-methyl diazepam. It will form a metabolite known as oxazepam that will later undergo conjugation and excreted. But these metabolites known as this-methyl diazepam and oxazepam, they have a longer half-life. You see the half-life of diazepam, it is only 8 hours. If you see the half-life of a metabolite this methyl diazepam, it is 60 hours, which is far longer than that of the parent drug. And once this metabolite is metabolized again to another metabolite, that is oxazepam, its half-life is another 6 hours, which means the actual presence of diazepam in the body may not be there in the urine, but the metabolite of diazepam will be there, and the effect of diazepam will still be there even if the drug or the parent drug diazepam is not found in the urine. That is why we have categorized diazepam under long acting. It may be easily removed, but the metabolite that it forms have a very long half-life. And we all know that for a drug to be completely eliminated, it will require 5 half-life. So if you multiply 8 by 5, you get 40 hours, which means within 2 days the diazepam will leave the body. But if you multiply the half-life of this methyl diazepam, which is 60 by 5, you get 300 hours, which is very long period of time, even more than 2 days. So that person will still be under the influence of the effect of this methyl diazepam, even though the body has completely eliminated the drug diazepam. Now, some of the uses of diazepams. It is used for diagnostic and minor operative procedure. Diagnostic means some kind of psychological disturbances in which you might want the patient to be sedated, little bit hypnotic, so that you can have a good conversation with the patient. Or a minor operative procedure means a patient might become very anxious, thinking of surgery or any minor procedure. So to calm that patient also, you can use the sedative and hypnotic drugs. It is used in case of insomnia. If a person is not able to sleep because of some kind of trauma, somebody has died or some other reasons. So in order to combat that situation, you may need to give him diazepam. Although we do not prefer giving diazepam in cases of bereavement, means if someone has died, because it is a situation that a person has to accept in life and move forward. Taking diazepam and skipping that situation is not an answer. So as much as possible, a person needs to accept whatever fact is there. Someone collapsed, something is happening in the life, rather than taking diazepam, forgetting about it and sleeping nicely. So diazepam is not the solution. It is only used if it is very severe. It is used as anticonvulsant, means for management of convulsions, epilepsy, seizures. It is used as anti-anxiety drug. If you are performing something on stage and you are very anxious, have a feeling that you might spoil something, then small amount of diazepam to forget about the crowd, to forget about all the anxiety that is there will help. But this does not mean that you consume diazepam before the exam to reduce your anxiety. You should also know that diazepam will also decrease the brain activity. So comparing the benefits over the risk, these drugs has to be consumed. And these drugs mostly are prescription drugs. You cannot go and ask for diazepam in the medical these kinds of drugs. It is also used for used as a pre-anesthetic medication. Anesthesia generally mean giving gas like nitrous oxide or halothane. But if you're not using diazepam, you might have to give those general anesthetic at a very high dose, which can ultimately produce toxicity. So giving a pre-anesthetic medication like thiopentone sodium or diazepam or some amount of muscle relaxant, and along with those drugs, if you give general anesthetic, the anesthesia will be very soothing and also less toxic to the patient. So though these sedative and hypnotics are also used as pre-anesthetic medication. It is also used for management of alcohol within a person who is addicted to alcohol. Suddenly, if he leaves the alcohol, then logical dependence, he might behave irrationally, he might behave violently, he might become very anxious. So, in order to condition, the craving thing does not precipitate, the dependence things does not precipitate. So diazepam like drugs are really helpful during that alcohol withdrawal syndrome. These drugs are also helpful to induce muscle relaxation. These drugs are helpful in inducing muscle relaxation. These drugs also produce anterograde amnesia. We talked about this before. Any very bad event is happening or is going to happen, and you want to forget those events, then you can take these drugs because they produce amnesia. You will completely have no memory of whatever has happened. Hypnosis, but basically these drugs also suppresses sleep. So in those conditions in which patient very severe and not able to sleep properly, anesthesia. When it comes to an use of sedative and hypnotics for anesthesia, the tablet forms are not generally prescribed, but we stick with IV because they produce very high bioavailability, they produce easy muscle relaxation. But these drugs, if you are giving during anesthesia via IV route, it might also become toxic. A high concentration can lead to respiratory depression. So you need to monitor the respiratory rate at the same time when giving these drugs for anesthetic purpose. Like excitation, somnolence, muscle weakness, fatigue, hypertension, respiratory depression, urinary retention, depression, overdose, which can lead to coma and death. Now, if you see the first adverse drug reaction, that is excitation, basically it does not make sense. Why it does not make sense is diazepam is a sedative. It should decrease the excitation. In fact, It is used to manage anxiety. How can a drug which is a sedative, which is a hypnotic, used for management of anxiety, produce excitation in a person? It does not make sense, but it actually happens. Why? Because another example that we can talk about is alcohol. Alcohol is also a CNS depressant. But when you take alcohol in a small amount, then you tend to talk more with the people. Even if you don't know those people around, you tend to talk more, you dance more, you enjoy the moment. That is excitation. So any sedative, if you consume at a very low dose, instead of being a sedative, it initially shows some excitation, stimulation of the central nervous system. And this is called disinhibition, which I can explain like this. Here you can see different CNS effect of sedative and hypnotics depending on the dose of the drug. Initially, at the lower dose, you will find paradoxical disinhibition. What it means, we'll come to that later, but remember the word paradoxical disinhibition at a very low dose. This is followed by sedation, anxiolytic action, anticonvulsant action, muscle relaxant action. Then a little bit higher dose, you'll find hypnosis. Then beyond that, you'll find anesthesia, where benzodiazepines and barbiturates, they separate, because higher than this dose, benzodiazepines will tend to plateau, whereas barbiturates, because it has a GABA mimetic action, will still produce more of CNS depression. CNS depression to the point of medullary depression and to the point of coma. So if you give a very high dose of barbiturates, the person can go into the stage of coma. Whereas if you give a very high dose of benzodiazepines, you will reach to a state of medullary depression, but you cannot go to the stage of coma, because benzodiazepines, they have GABA facilitatory action and not GABA mimetic action. So here we can see a clear demarcation between a barbiturates and a benzodiazepines. So we were talking about excitation as an adverse drug reaction to sedative and hypnotics. And this excitation is because of this first term that we see over here, paradoxical disinhibition. Here GABA is an inhibitory neurotransmitter. It is supposed to produce depression. Glutamate is an excitatory neurotransmitter. It is supposed to produce excitation. But what if there is another GABA in front of GABA? So instead of producing depression or inhibition of a GABA neuron will lead to excitation, or inhibition of a glutamate or excitatory neurotransmitter can produce depression. So here glutamate, instead of producing excitation, it is producing depression, and GABA, instead of producing depression, is producing excitation because of presence of another GABA neuron in front of one neuron. So this is called paradoxical disinhibition, which leads to excitation as one of the adverse drug reaction to diazepam. So for now, let us end our class over here. We'll talk about more of these sedative and hypnotics in tomorrow's class.